This case study examines the use of human chorionic gonadotropin, hCG, to restore testosterone production in athletes who have used anabolic steroids. While this practice is widely known among athletes, little scientific research has been conducted on the topic. A notable exception is a study published in the Postgraduate Medical Journal in the 1990s by British doctor Geoff Gill. The study focused on a 17-year-old athlete who sought medical help for impotence and other symptoms after using steroids for an extended period. The young bodybuilder initially visited the doctor due to concerns about a varicose vein. However, he also reported additional symptoms, including impotence for 4 months, decreased libido, poor sperm quality, and sore nipples. Upon examination, doctors determined that the athlete had been using various steroids for at least 6 months without realizing they were causing his health issues. The steroids he had used included nandrolone and possibly stanozolol. He had also taken danazol to counteract nipple tenderness. Medical tests revealed that the athlete's pituitary gland was no longer producing luteinizing hormone, LH, or follicle-stimulating hormone, FSH. Since the bodybuilder wished to continue using steroids, doctors prescribed him a less harmful option with injections every 2 weeks. This treatment temporarily resolved his impotence and restored his libido. After 15 months, the athlete stopped using testosterone injections to focus on his studies. However, his symptoms returned and his testosterone levels dropped significantly. To stimulate testicular function, doctors administered hCG injections over a 3-month period. The treatment began with 20,000 units intramuscularly weekly for 1 month, followed by 5,000 units weekly for another month, and finally 2,500 units for the 3rd month. The results were promising. Within a week of starting hCG treatment, the patient's libido greatly improved and he experienced spontaneous nocturnal ejaculations. Over the course of the 3-month treatment, his serum testosterone levels and potency returned to normal. However, Dr. Gill noted that after discontinuing hCG injections, the patient's testosterone levels fell below initial levels. This observation raises questions about whether natural testosterone production would have recovered more quickly without hCG intervention. This case study highlights the potential effectiveness of hCG in restoring testosterone levels in athletes who have used steroids. It also underscores the need for further research to better understand the long-term effects of both steroid use and subsequent hormone treatments. Athletes considering the use of performance-enhancing substances should be aware of the potential risks and consult with medical professionals to make informed decisions about their health.